ASEAN's per-person healthcare cost averages at $630 as governments look for ways to expand access and keep care affordable. Public-private partnerships are gaining traction, especially with support from EU-backed initiatives. EU-ASEAN Business Council's Chris Humphrey is here to share his insights. So Chris, for ASEAN governments facing rising healthcare costs, what kind of PPPs actually help ease healthcare costs?
I think the first thing to say is we need to have a complete review of how ASEAN governments are approaching healthcare in general. We need to move away from a system which is basically based on curative care, so treating people who are sick, to a system that is more focused on prevention, so that we actually reduce the number of people calling on primary healthcare services to make themselves better. And there's a number of areas there on the PPP side of life where businesses, European healthcare businesses, are willing to help and want to help with governments.
Can you tell us what can be considered as the biggest policy misstep in involving the private sector to help with public health care?
I think one of the things is having an enabling environment which helps private companies work with governments to improve the delivery of healthcare across the region. A lack of harmonization of regulation across ASEAN member states is an issue. If you're working across the entire region, you want to have a predictable regulatory regime that is operating in a similar way across multiple different jurisdictions. Otherwise, you're having to tailor approaches to each individual market, and that becomes very, very costly. The other issue, I think, as well, in some markets, we do have a prioritization of local content. And while we feel that is understandable in some circumstances, it doesn't actually help. We're talking about healthcare here, the development of diagnostic systems, the development of new medicines. It costs money, it's a lot of R&D involved. And often that production needs to be done in very specialized circumstances. Having local content requirements doesn't actually aid in the delivery of such things.
So considering all these, how can ASEAN countries better prepare for future health crises?
Well, I think if we look back at the COVID-19 pandemic, ASEAN didn't do too bad a job of coordinating things, but there does need to be some improvements. I think we need to strengthen the regional health, security, resilience systems. We need to create frameworks across the region for a coordinated crisis response. That means they need to work better and they need to be preparing for things going forward. But I think another axis of this is prevention. Prevention is the best form of defense, after all. We need to do a lot more in the area of providing self-care initiatives. The European firms working in the self-care space have a lot of ideas for improving things like health literacy, teaching people how to live their lives better, how to improve hygiene standards, etc. I think we can do a lot more on developing things like telemedicine going forward. People forget during COVID, there's a lot of telemedicine going on. We were consulting GPs, we were consulting doctors over Zoom calls, over Teams calls. I think we just need to work on that more and perhaps develop more apps as well to help people check on themselves, monitor what their well-being is. And then we've got the tools in place where if it is, God forbid, another pandemic, that we can actually react properly.
Thank you so much for joining us today and for sharing your insights, Chris.
My pleasure. Thank you for having me on.
Once again, that was Chris Humphrey, Executive Director at EU-ASEAN Business Council. For more news, visit govmedia.com.